Hi everyone, this is Dr. Stefan. In this one, I'd like to answer a quick question. So, someone asked me on the channel how to rinse your mouth after taking an inhaler. So, for example, you've used one of these, and after you've taken the inhaler, you've been told that you need to rinse your mouth. How do you do that exactly? So, this is a very important thing that is often overlooked, and I do urge you to consider, especially if you're using inhaled corticosteroids, and you can check that on the package leaflet, or your doctor might tell you that you're on an inhaled corticosteroid. It's quite important actually to rinse your mouth, to gargle and spit the water out after you've used the inhaler. Do not obsess over this. So I wouldn't say that it's something to obsess about. If you forget it one time, it's not the end of the world. But I would say it might be a good idea because it can help prevent some of the side effects from inhalers. So most commonly, people do not have a lot of side effects from inhalers actually. But sometimes what may happen is that people may develop a hoarse voice. They may develop some oral candidiasis, which is a fungal infection basically affecting the throat and mouth. Those can happen because the steroid sticks to the sides of the throat and it's not actually going deep inside the lungs. Now, that can be sometimes due to poor technique. So it's always very important to check that you are using your inhaler correctly. Check that with your doctor at each consultation if you can. Take the inhaler with you, take a puff, with your doctor present so they can give you some direct feedback. It could be your specialist nurse as well or someone else who's looking after your care. It's important to get that feedback. There are also videos online. I have some on my channel as well about how to use inhalers. If you find them helpful, very good. If not, do check with your doctor to make sure that you're using it correctly. That is the first thing. Now, if you're using the inhaler correctly, if you are rinsing your mouth at the end, it actually can prevent some of these other side effects that I've mentioned. Now, how do you actually do that? So many people use mouthwash, which is fine, but even simple water is good enough in most situations. So what I would recommend is if you're after you've taken your dose, for example, say you need to take 2 puffs of your inhaler. You take the 2 puffs, and after that, go to the bathroom, take a little bit of water, swish it around your mouth, gargle, 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 and then spit the water out. You don't need to swallow the water because it will contain any powder or fluid that's left around the back of your throat. So just spit that out, and that should be enough. If you prefer to use mouthwash, that's absolutely fine. It's not an issue. So if that works better for you. But I would really urge you to spit the water out, to not swallow it, because many people do ask me that question. The other thing that is related to this is some people wonder whether they can eat after taking the inhalers. Now, in my opinion, there isn't a problem because the inhaler, if you think about it, is designed to deliver medication within the lungs. The lung passages have nothing to do with the stomach passages, esophagus, etc. So basically, if you've inhaled the medication correctly, if potentially you've rinsed your mouth, gargled, and spit the water out, then you can eat. It's not a problem. There shouldn't be an interaction, especially because the dose of inhaled medication is very, very low. So in most cases, it hardly gets absorbed into the rest of the body. It just acts locally within the lungs. It's as if putting ointment on a wound, but you are treating the inside of the lungs. So this is something that, again, simple things, but these questions do come up again and again on the channel and in real life. So I thought I'd make this quick video, quick reminder that it's important to rinse your mouth after taking your inhaler and to do it correctly to spit the water out. Hopefully that was helpful. And if you have further questions, there are no silly questions. Leave them in the comment section below. All the best and good health.